She will need care for the rest of her life, and it's a heartbreaking concept, and it's a heartbreaking thought to know that she may at one stage in her life need care, and we will not be around to give her this care. And it's the thought of it makes me want to cry. It feels like our child goes to a special needs school. We've seen no improvement in the schooling. It's like everyone around her is more like a tool. When every concerns, it just went out the window, and we feel we're in good hands here. Whatever you need here, pretty much you get it before you've even finished asking, or you don't even need to ask. Or when I saw a few YouTube videos of children with my daughter's symptoms and saw the improvement, that I became kind of a bit more convinced with the stem cell treatment. No one's going to live forever, and I want to be satisfied that we've done the best we can for our child. We feel that the Swiss Medica, they're a godsend, almost literally.
Hello, sir. Pleasure to have you here with us. Can you please introduce yourself and tell us what brought you to Swiss Medica?
Yeah, I'm a parent of an autistic child. We're based in the United Kingdom. We're not satisfied with the level of the options of treatment that is available with the United Kingdom. My wife did some research into some alternative treatments, and we came up with we saw some very good positive reviews and testimonials from people who had visited Swiss Medica in the past. Again, it's with the costing as well of the procedure, we found that we opted for Swiss Medica based on the quality of the treatment and care that we've seen from other patients and other parents, and also for the cost effectiveness of you guys as well as Swiss Medica. So on the basis of these two quite important factors, we decided to make the trip over here to you guys.
Okay, can I ask if you can share with us daily struggles and the challenges you have as a parent of autistic child?
Well, daily struggles is our child is nonverbal, so it's she cannot communicate anything when she's hungry, when she's wet herself. It's just a case of she just cries, and we then have to interpret what she needs, which is very difficult. It's like everyone around her is more like a tool. It's not us, myself. It's a tool for her to be fed, or it's a tool for her to whatever, So it's a bit difficult. We have other children who, and I've experience with children, but with this particular child, it will be quite difficult. She's over 4 years old now. She's at the stage where she should be potty training and not wearing nappies, but she still wears nappies, and she will need care. Without some significant improvement, she will need care for the rest of her life, and it's a heartbreaking concept, and it's a heartbreaking thought to know that she may at one stage in her life need care, and we will not be around to give her this care. And it's the thought of it makes me want to cry. It feels like, it's very difficult. So we're hoping that we pray that this is going to be an opportunity for her to live a normal life, and when my wife and I are no longer on this earth, we can leave Imani with the thought of knowing she can take care of herself, really.
Right, sir. You mentioned that you're dissatisfied with options available in your home country. May I ask what other procedures or therapies you tried to address these issues?
Well, where we're from in the United Kingdom, they don't seem to encourage any treatment. They seem to, it's almost like they want the child to, the resolve to the child to stay as it is, as they are. And there was not really any treatment available. our child goes to a special needs school. We've seen no improvement in the schooling. Everything is you know, and they seem to be in the United Kingdom. They seem to be really against you know, any alternative treatments, and the treatments available there seem to be almost non-existent. There's no treatment there per se. It's just a case of, you know, you send your child to a special needs school, which our child has been going to for a number of years, and we have seen no improvement, to be honest. So it's one of those things where we're hoping that this is going to be like you know, it's like a Hail Mary, you know, a Hail Mary attempt for normality for our child, you know.
That's right. Can I ask, while doing your own research about stem cells, what you read or what did you see about stem cells that inspired you the most to give a chance for this treatment?
It was, to be honest with you, it's mostly my partner, my wife, who did a lot of the research. She's more kind of the one who knows more about medicine and medical procedures. She's had a bit of she's got quite a lot of medical experience, to be honest. You know, so she's the one that found the clinic and the treatment and so on and so forth. And from what the little I know about it, it's an alternative and quite new, revolutionary kind of treatment that will, you know, replenish or replace the cells that we believe is causing the autism and preventing her normality. So we, as I said, please forgive my ignorance, but it's a treatment we are, you know, up to the best of my understanding, that will replenish or replace the damage or missing, you know, cells that are causing her autism.
Exactly.
Yeah.
On that topic, did you have any kind of worries or any kind of apprehensions traveling to Serbia to receive this treatment, since probably it's some familiar country for you? Or did you have any kind of doubts about the treatment itself?
Initially, I did have some doubts. Initially, I did have one or two reservations. I didn't know much about the country. I have quite a lot of Kosovan and Albanian friends, and I thought to myself, you know, knowing the history, a little bit of history, I thought to myself, oh, you guys have not been very nice to my to my Kosovan and Albanian friends in the past, but we cannot blame you. There's nobody in this. I'm straight off topic. Yeah, yeah. It's just I have a lot of Kosovan and Albanian friends, but I didn't tell them I was coming here. But knowing a little bit about the history, you know, yeah, I thought to myself, you know, yeah, there's a bit of history of you not being very nice to them, you know, you guys, but it's not yourself personally. People that probably not, you know, that another generation, you know, yeah. But all my fears, when I researched into the stem cell treatment, I became convinced that if anything is going to pretty much help in a quick or short space of time, it's going to be the treatment. We've seen other children who have received the treatment who have shown some drastic improvement. I was watching on YouTube, there was a young girl who seemed to exhibit all the symptoms of my daughter, you know, like the sort of the clapping of the hands and, you know, non-verbal, and sort of just seemed to, it was almost like, it was like my daughter, but in a different person, exactly the same symptoms. And she had received the stem cell treatment, and after some few years, she was normal, you know, she was talking. And I didn't believe a child of that young age could be, could be taught to pretend like that, you know. Just the child seemed, it's like, you know, it seemed too young, you know. And then I kind of became convinced, you know, when I saw a few YouTube videos of children with my daughter's symptoms, and saw the improvement, that I became kind of a bit more convinced with the stem cell treatment. And coming over to Belgrade, Serbia, and the interaction with the Swiss Medica people, I became convinced that this, this place is just as good as any healthcare. I mean, I only have experience with UK, but I've experienced NHS, and this place I think is head and shoulders better than the National Health Service. And I've actually also experienced the private healthcare sector as well, and this place is, I think, probably excels, than even private healthcare. The people here have been so accommodating. Nothing is too much. When we got here, we asked for milk for my daughter. On the way back, the shops were closed because our flight was very late. And by the time we were moving our luggage we were picked up from the airport, by the way, in a private spacious vehicle, people carrier. The gentleman was there waiting for us when we landed. Very nice guy, Pavel. His name was. We got here past when the shops were closed. My daughter, she needs her milk like religiously every 3 hours. Otherwise, it's a big problem for us. So we were a little bit concerned. When we got to the clinic, before we even removing our suitcase, somebody came and gave us a carton of milk. I thought to myself, wow, it was just it's so efficient. And whatever you need here, pretty much you get it before you've even finished asking, or you don't even need to ask, or if they don't have it here, it will be tomorrow. Or these people, I don't think they know how to say no. They don't know how to say no, or they don't know how to refuse people. And very, very accommodating, extremely accommodating. The staff, all the staff, the medical staff. There's a young doctor, Dr. Schnezner. So lovely, such a wonderful bedside manner. It really makes you feel at home. These people, they make you feel like they're gonna move heaven and earth to treat your child. And as I said, I did have concerns of coming to the country. I did have concerns of the treatment, but staying here, seeing how professional the clinic is, and seeing how accommodating and wonderful all the staff members are, when every concerns, it just went out the window, and we feel we're in good hands here.
We're so glad to hear that. Did you feel that procedures were safe? That you were, that treatment plans were explained comprehensively? Was on that front everything according to your expectations?
Yeah. I think I had no concerns with the procedure. It was the clinics seemed very, very clean and very spotless. The procedure was carried out in a very professional way, and it's just it's something now we just have to, everything we put it in the hands of. Ultimately, it's in the hands of God, but we feel like the people at Swiss Medica, they have been sent by the Lord Almighty to do God's work, which is to heal children, and heal people in general.
And one of the last questions we like to ask, sir, for the parents that are facing similar challenges or difficulties, would you have any kind of advice or a general insight that you would like to share?
I mean, yeah. It's still early days regarding any results or anything like that. But I mean, we'll have to wait and see with that. But all things being well, if the clinic does what we hope it can do, then we would we think why not give it a chance? Like what do you have to lose? It's only money, and you're not going to take it with you to the grave. And I would sooner go to my grave knowing that I've done the best for my child, and I'd sooner maybe go into the grave with the memory of knowing that we've been able to do something effective for either way. The way I see it, what do you have to lose, really? Because the money is actually it's not crippling. It's not the kind of amount that will cripple you. But as I said, no one's going to live forever, and I want to be satisfied that we've done the best we can for our child, you know, whether it's successful or not. And if it is successful, then, you know, I would have paid 10 times this amount for for a successful treatment, to give my child the opportunity for a normal life where she will not need constant care, she will not be a burden, she can, you know, really enjoy this gift of life that she's been given, and help to communicate in a good way, to be able to kind of get the most out of life, you know, without being hindered. So as I said, yeah, it's just yeah, I think you know, I think it's it is there's nothing to, you know, why not give it a try, you know. Your child, you know, or you want eventually your child to be able to look after you. If you want the child to be able to look after us and later on in life, without, you know, we don't want to be old and having to look after, you know, the bigger the child gets, the more, the harder it's going to be, you know. And the older we get, the more difficult it's going to be as well. So it's why not give it a try, you know. If it doesn't work, then it doesn't work. But if it does work, then it's almost, it would literally be like a miracle, you know. If you believe in miracles and, you know, believe in God, then you know, we feel that Swiss Medica, you know, they're a godsend, you know, almost literally.